Africa is rising in clinical research, but as 54 countries, and you have to navigate 54 different types of regulations. And sometimes that could actually feel like you're trying to decode an ancient script. What if I had a tool that could map all of this for you? Hello again, I am Tengu and I am the creator of the Clinical Operations Strategy Toolbox. And today I am excited to demo the African Clinical Trials Navigator. It is an amazing tool that can allow you to understand the regulatory landscape on the African continent, whether you're beginning to explore the African regulatory landscape or you want to run a multi-country study with Africa included. This tool should give you all the resources that you need. So let's jump right in. So this is the African Clinical Trials Navigator, and I'm getting ready to ask it the first question, which is, what are the main regulatory authorities in Nigeria, Kenya, and South Africa, and how do their timelines compare? As you saw in a previous video, you could speak to the tool via audio, asking the same question, and then of course you're going to hit this button and it will then start responding to you. So today I just typed it in for you, pre-prepared, and let's go ahead and get the answers. And it proceeds to give us a breakdown of the regulatory authorities in Nigeria, in Kenya, and in South Africa. So that was the first question. For the next question, I am asking which African countries currently emphasize DEI frameworks in clinical research. Fantastic. So South Africa currently has a robust strategy for DEI in clinical research. So does Kenya, Rwanda, and then there are also regional and Pan-African efforts. And then these are the key takeaways. Of course, you can dive deeper and maybe find out what exactly the African Medicines Agency is doing in terms of DEI. And then I'll go ahead and ask the last question, which is, how can I identify reliable CROs or academic site partners for multi-country studies in sub-Saharan Africa? So it talks about defining your partner criteria. You can shortlist with this right here, and then use partner scoring tools that are AI powered. Yes, like this Jali9 AI tool. And then these are others. And then, of course, you want to target leading academic and hybrid CRO site hubs. And then you want to evaluate with a CRO partner scoring checklist or engage via regional networks or events. And then their final tips here. I've included a link to the African Clinical Trials Navigator below, as well as my link tree where you can book private or group coaching.